Hi, good afternoon. I'm Dr. Mark Jeffery at Ulala Cosmetic and Laser. Today we've got one of our staff members with us, and she is about to have her birthday in a few days, and so we're giving her a little birthday present. Our client had some lip filler done approximately 1.5 years ago, roughly November 2019. Very good result. She had pretty much a flat lip, and even today, when we do this augmentation, we will rarely be doing enhancement of other areas of the lip rather than just trying to create a big voluminous lip, which clearly won't suit her. So if we just look at her structure, essentially, we can see she's got a beautiful cupid's bow. She's got nice eversion of the lip, probably a little bit flat out wide, so I will roll that out a bit today by injecting the lateral corners. She's got beautiful tubercles here, which she likes in the lip, and I won't be doing too much more, but I will be creating a little bit more volume through this area here. I think in a patient like we've got here, you've got to be very careful that you don't overfill the lip, because she has a small mouth and a fairly longer face relative to the width. So it's important to keep your dimensions appropriate and try and just enhance the volume she's had, and she clearly has held on to this product particularly well after looking at her previous photographs. Alright, so I use many different types of techniques for injecting lips, and it really depends on the client and their anatomy, what the client wants, trying to meet the client's expectations, but also being realistic in what we can achieve. So I'm going to concentrate with our client more in the central portion here, certainly in the top lip, and I'm going to put a bit more product out wide and then just a little bit through the top. I don't think I'll use more than 0.25 on either side. Maybe I'll get away with 0.3 to 0.5. We'll just see how we go. Alright, so very simply what I'm going to be doing is just depositing 0.05 just lateral to the fulcrum, the patient does have some numbing cream on. Alright, that's coming up nicely, and then I'm going to put a small dose just underneath the base of the cupid's bow. She does feel that a little bit. That's okay, Holly. You know, if you need to, tell us to stop, but it's not going to be for long. Okay, that's just elevating the cupid's bow there. Now we're going to do the just lateral to the fulcrum again, just small injection. Okay. Okay. How did that go, Holly? Just
Good.
A little bit there? It wasn't too painful?
No.
Okay, so you can see we've augmented this part of the lip. There's no need for me to accentuate the fulcrum. Some people call this the Russian lip by injecting down the side. You know, at the end of the day, there are many techniques to inject the lip, and I think this one will be the one that I'm going to use with Holly. You can see with Holly that she falls away here. So I use a special way to inject this. I bend the needle a bit, and then I do the injection. So we're just going to roll that lip a bit. This is a technique that I do. I come from underneath the lip, and I just float this over the top of where I put the bolus doses. And then I'm just going to retrograde as I come out with the client, and I'll put a little bit more in the middle there. There we go. Okay. What I'm going to do now is I'm just going to inject the lateral border of the lip. So in this area here. And those are little threads that I'm putting in. Just mobilize the product a bit. Okay. So let's just see what we've got now. So what we can see is it looks nice and natural, and we can see that she's had a nice enhancement of her upper lip on that side. Alright, we're just going to do this little bit now. Sorry, Holly, that's a little bit uncomfortable. Just bear with me. Okay, so we're just going to retrograde now again. This product is a great product for lips. It's called Kiss. Let's just check our symmetry there. It's not bad. Okay. Right, we're just going to inject this area now. Okay, looks like she still needs a little bit more in the top lip on this side. So we'll come up a little bit closer to the lip border. I don't generally inject the lip line very often for various reasons, and I'm sure most injectors that do a lot of this would agree. Okay, so all I'm going to do is just feather out the lateral margin of the lip and just do a retrograde injection. That's just 0.1 of a mil. You sometimes come across clients where the red roll has meets the skin of the lower lip a little bit higher up. So just follow the natural curvature of the lip. Close. I'm just going to put a small dose into the central part of the lip, just to roll it a little bit more. So I'll only be using 0.05. Sorry, Holly, this is a bit tender. And we'll come out now. Okay, close. Alright, so we use 0.7 mil of a mil with Holly, 0.5 on the top, 0.5 on the top, and about 0.25 on the bottom roughly. I think that looks more natural. We've got a little bit more elevation laterally, a little bit more extension of the lip wider, and a little bit more volume out wide. She didn't need any treatment in the tubercles, they're still good. All right, thanks. If you have any questions, you're more than welcome to contact Ulala. We do a lot of lip injections, and as I said, there are many techniques. There's a certain art to doing these procedures, and you need to assess the patients. We often get clients with asymmetries of the lips, either congenital or alternatively because they've had filler and it's an asymmetrical lip because there's been differential volume put into the lip, or they haven't looked at the asymmetry appropriately. So what we normally say to Holly, we'd like her just to build on this. She's had a fantastic result. As I said, she had a very flat upper lip. All right, thank you.